in our next episode, Dr. Martinez will be talking about what happens to the central nervous system. So I always say to my patients, I'm fine, you're fine until we check your spine, right? Because the true effects of car accidents might not show up for 2 days to 2 weeks to 2 months after it. So this is a test that we want patients to come in and really see. So 27 years ago, when I was just starting in practice, one of the internationally renowned journals, the Spine Journal, came out, and in a supplemental issue, they talked about how there was a pandemic in the fact that the world's trauma centers in emergency rooms they were losing the battle when assessing, diagnosing, and treating whiplash injuries, acceleration, deceleration injuries to the cervical spine and neck. In fact, it documented that 2 years after a motor vehicle, 20% of injured were still in a moderate to severe pain level. And they also said they needed a better way to diagnose soft tissue injuries, as well as a more efficient form of treatment. This device checks both those boxes. And this is just one of the little excerpts. It was a round table, and they said, can early treatment prevent acute whiplash from becoming a chronic issue, meaning long-term, more than 30 days? And they talked about how common types of neck injuries, typically caused by rear impact, traffic crashes. Studies consistently show that neck pain and other symptoms of acute whiplash injuries clear up within a few months in about half the patients. The other half have continued pain and disability 1 to 2 years later, with 20% of those. And they talked about early management was critical in the long-term approach of how to treat these patients. Many different treatments were looked at: immobilization, acupuncture, electromagnetic, ultrasound, even invasive facet injections. Okay, and we'll talk about it. But none of these treatments over the last 25 years have actually been shown to reduce any of these major issues. So we're going to dive into, and I'm going to show you, obviously you can see what happens, but in the other studies, it says 33% of whiplash injuries go undetected at ERs. That's terrible. Delayed diagnosis has been attributed to various reasons why people are just not getting better. And you can see what happens to the X-ray or the cervical spine, right? That's an extension and then flexion. So that's what happens. First, it's really a process that we're going to look at and break down in a video. But motor vehicle accident injuries go undetected. Misread radiographs 35% of the time. Absence of symptoms after the first visit is a big one. But also, they're missing the diagnosis on a facet flexion extension injury. These are the little joints in between the cervical vertebrae, and they all have these ligaments that are like rubber bands that hold all those bones together. There's several ligaments that we'll look at in the next few minutes. So this is what, on the left, this is what a normal cervical spine should look like, with all the weight, 2/3 of the weight are on these pillars. They're called lamina, and they hold the weight of the head back there. And then you see the spinal lamina line. Here's the spinous process, the front of the vertebral bodies. This is an example of someone who has an abnormal cervical spine, typically resulting in after a spinal injury or a whiplash type injury. This is a mechanical issue, right? So if you have your pinky and you push it back, that's a mechanical stress on these joints. And what happens is if you dislocate that and it holds like that, that's a problem, right? But you would go to the doctor because you see it every day, but people don't see this in their cervical spine. You're going to talk about the torsion and tension that happens, but this is C5, C6 is typically the main area that's damaged. That's the stress point. And I'm talking about the bone and the mechanical issues. You're going to talk about the central nervous system at our next one. And again, this is what happens when you look at the intersegmentals. There's flexion. This is bone, disc, bone. This disc can be damaged, but also these facets, these pillars back here, are little capsular joints that have synovial fluid. They're actual joints. So I'm going to show you on the left is looking at a pretty extensive MRI. And you can see the brain, brainstem, and spinal cord. They're named differently, but they're all one thing, right, Doc?
Yes, they are very connected.
They are our central nervous system. MRIs look at soft tissue, and the X-ray looks at bones. And this is side-by-side view. So there's C1. Your brain stem comes down right into these two. What's that called? The foramen magnum, correct?
Yes.
And that's the thickest part of your spinal cord right there. And it's kind of where the brain and spinal cord transition. When they hang someone, this is where you break that bone between C1 and C2. Is that correct? What's that called? The osidontum?
Mm-hmm. Hyman fractures also.
Yep. But you can see all the gestures. This is, but I want you to understand that we're more complex than just a two-dimensional X-ray or MRI. And what they're saying is during that rear end injury, your neck actually folds into an S curve, which damages where these small capsular joints are in the back of the pillars of the joint. So I'm going to show you what that looks like. That's intersegmentally. That's where they actually do facet blocks. That is invasive. We want to explore and exhaust every alternative condition before we invade or puncture the skin.